All right, joining us live now is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, it's good to see you again. We haven't chatted in a while. Thanks so much for joining us. I want to start this morning by talking about whooping cough. You know, there's an outbreak in New Brunswick, and of course, Eastern Canada. It's causing a concern for school as kids return. We were just speaking in the break, and whooping cough is something that, you know, kids get vaccinated for. It's been a while since my kids have gotten their jabs, but what should parents think about, you know, with the spread of this happening?
So, unfortunately, we're seeing the reemergence of vaccine-preventable illnesses. Right now, of course, we're talking about whooping cough, but we were talking about measles earlier. Again, these are, as you point out, there are routine childhood immunizations for this. Whooping cough is routinely given at 2 months, 4 months, 6 months, 18 months, and then once again before a child enters school. We know that many public health programs were disrupted during the toughest times of the pandemic. People might have missed a dose of a vaccine. It's just important to note that this is a vaccine-preventable illness. It causes a very severe cough in children. The nickname of this disease is called the 100-day cough because it can cause a terrible cough for a long weeks and weeks and weeks. It's part of the routine childhood immunization program. If you look at the yellow card, if you're to make sure you're up to date, if there's any questions, any concerns, you can speak with a healthcare provider. You can go to a public health clinic. We know many people don't have a family physician, but there's public health clinics all over the province of Ontario where people can go to ask questions. And if they're not up to date, they can receive an immunization for this.
Okay, yeah, good advice there. I think I had whooping cough when I was about 9 years old, coupled with asthma. And I remember a stay in the hospital wasn't fun. So hopefully no kids have to deal with that. But Dr. Bogoch, the spread of Eastern equine encephalitis through mosquito bites. This is, you know, we've heard of West Nile virus, but this is also pretty serious and can be deadly. It has towns in Massachusetts trying to curb evening activities. They've even set up a suggested curfew. What can you tell us about this disease and the possibility of transmission here in Canada?
This is an extraordinarily rare infection. I can't stress this enough. This is an extraordinarily rare infection. I believe the last case we had in Canada was in 2016. Okay, like this is extremely rare. It is mosquito transmitted. It's called Eastern equine encephalitis because the first cases were identified in horses in Massachusetts in the 1930s. Encephalitis means it causes inflammation of the brain. Yes, while it's extraordinarily rare, it does cause a very severe illness where about a third of people will succumb to this illness, and people who survive are very likely going to have some permanent neurologic deficits. But again, it is extraordinarily rare. Sometimes when it is picked up, it's usually in the summer months, and it's usually in the eastern part of North America. Most of the cases have been identified in New England and around the Gulf Coast. But yeah, I mean, Canada had a case way back in 2016 in a human, and there have been horses who have been infected with this very rarely, but still it's reportable, including this year. So, you know, there's a lot of good reasons to not get mosquito bites, mainly because they're annoying and they're itchy and no one wants to get a mosquito bite. A more common infection, of course, as you point out, is the West Nile virus, which, again, mostly causes a fever and rarely causes a more severe neurologic issue. And Eastern equine encephalitis is exceptionally rare anywhere, and especially exceptionally rare in Canada, but is a very dangerous infection.
Okay, so it sounds like you're saying, yeah, Toronto, hold your horses, literally and figuratively. You don't need to go into lockdown just yet over this triple E mosquito bite virus.
That's exactly what I'm saying.
Okay.
Hey, listen, the fact that we're having a conversation about it and can contextualize this so people know that the risk of Eastern equine encephalitis is about 0% in Canada, I think is important. But we all learned something about a virus that many people have never thought of before. So that's exciting.
Yeah. Okay, Dr. Bogoch, unfortunately, we're out of time, but we always appreciate your time. Have a great weekend before school starts, and we'll chat with you soon. Take care.
Have a great day, Jennifer.
Thank you.